Hello viewers, and welcome to today's edition of our program, the Health Center with Ozion at Kunye. Here is presenting to you the topic Hole in the Heart by your presenter and regular anchor, Ozion the Expressionist. Yes, this topic has been discussed on live program, and today we are going to discuss it now on a recorded program. And remember, during the live program, it was difficult for you to see the reflection of what I was writing on the board better. But here, in a recorded program, the camera will keep it just the way it is. So hole in the heart will be shown as hole in the heart, other than the other way around, where it's hard for you to see it. Now it's better. Okay, and I'm going to make the writing a little bit better for you to see. So today's hole in the heart explains the problem that we normally see in children. Yeah, you hear that this child is suffering from hole in the heart. And you wonder, is it your making? Who did this to me? And people wonder, why punishing this child? Actually, it's a mystery. It used to be a mystery before. Yeah, but science has enabled humans to be able to find out what actually is this. But still left in the mystery of what causes it. Somehow, we have the different types of hole in the heart. We have three major hole in the heart we know. We have two at the upper part of the heart. I'm going to draw it. And one at the lower part of the heart, the main chamber of the heart. Because these holes are inside the heart. They don't just perforate and come outside the heart. And two of them are congenital problems, meaning that they are problems that the child took up from the womb, due to certain kind of things or factors the child inherited while coming out from the womb. So it's a problem the child took from the womb of the mother. So it's not like saying a hereditary, no. It's a malformation that existed in the womb. And there is one that is the major one and the most common one, known as the PFO. So hole in the heart. So we have the heart like this, for instance. Yeah. And you have this, the heart has two chambers, the upper chamber and lower chamber, and something divides it like this, known as the septum. The septum is a wall or a muscle that binds the two chambers of the heart. So here, these two chambers are actually four chambers because I divided it here. You have 1, 2, 3, 4. And this is the right atrium, this is the left atrium, this is the left ventricle, this is the right ventricle, and this is the left ventricle. So with these chambers, there is a pathway here, and there is a pathway here. This is a valve known as the mitral valve. This is a valve known as the tricuspid valve. See? So now, there is another pathway here. This is a path. This is a path for a big artery and a big artery. This one is the pulmonary artery, and this one is the aorta. So what happens is that normally in our heart, this place is closed, and there is a big vein and a bigger vein here. This one is called the inferior vena cava. And this one is called the superior vena cava. So the blood that comes from here comes from the part of the brain, from upper here down, goes down to the heart before it goes down. So it's actually when it must have been filtered and oxygenated. That's actually the word. So now, if the child is in the womb, it's a different thing. Because here, there is supposed to be a way out here in our normal heart that goes to the lungs where it is being oxygenated. But in a child, this lung, as much as the child has a lung in the heart, in the womb, the child does not use the lung in the womb until the baby comes out. How? Because in the womb, there is this thing called the placenta, which covers the womb of the woman, that now kind of encapsulates the child. It is from this placenta that the child derives oxygen and nutrients with which it survives. And to this placenta, there are veins, 3 veins. 2 of which are arteries. Artery delivers the oxygenated blood today, and the one is a vein which delivers the blood that is already used up. So, but this blood that is used up through this vein now comes out and go to this place. This is the inferior vena cava. Now the blood from here pumps into the heart, coming to this chamber known as the right atrium. When it comes into this right atrium, it goes directly. Now, this barrier is very pertinent to know. This barrier we have here in our heart does not exist like this inside the womb. Inside the womb, it has an opening, natural opening. The natural opening here is to help the blood to go through here because there is no way to oxygenate it here. So when it goes through here, when it goes through this place, it's able to move and pass through again to go here to do the job of the filtration again. So instead of going through the lung from here, it goes through the lung afterwards, after it has done its job to go into here. So because it has to come down here and move through the aorta, and that's how it continues. So what happens now is that this blood flows here. Normally, this chamber of the heart should be higher in pressure than this chamber of the heart. The left is often higher in pressure than the right side. But this baby now, when this blood comes, this place is called the foramen over. It's an opening naturally built to or open to, is a valve naturally there to help this blood to move through a direction it will not move when you are born. So when it moves into this place, this is how it gets oxygenated, the placenta comes again, and the system continues. However, when you are born, this place is supposed to be closed up. So when you're not born, and what makes it to close up? It closes up when the child has his first breath. That time the child has the first breath, the pressure of that breath it has that reach the lung comes in, and naturally this place is closed. That's just it. It doesn't just close automatically, but it begins to seal up, and nothing else. There will be nothing like the blood passing through here again, because if it continues passing, it will begin to give a kind of malformation to the child because it becomes a dysfunction. That which means that this is the number one hole in the heart, because the child might live with it, keep growing, and you wouldn't even know that this child has a problem. It's just asymptomatic until at a certain point. Why is it asymptomatic? It's asymptomatic because this place is supposed to have a higher pressure, but this place is now granting it the pressure, the blood, and it comes there. So the way it's moving does not really make this place to really have that kind of, it doesn't really make the heart to demonstrate every evidence that this actually, and it's very small. So the explanation may not be very clear to you, but just understand it this simpler way. If there's any question, just ask me so that I'll be able to. But that's actually what makes it. You wouldn't really find that. When I explain the other hole in the heart, you understand what exactly it means. Because with this, the child might be growing until it begins to feel certain symptoms. The symptom might be like fainting, which is called syncope, low oxygen in the blood, which is called hypoxemia, and as well as stroke, hypertension, all the murmur, these kind of symptoms that might equally lead to heart failure. Now, the other hole in the heart might be another hole here or here that is just a malformation, a kind of malformation in the womb called a congenital problem. A congenital problem. The name here is ASD, which is anterior septal defect. It is at the septum, so there's a defect. So this one is a defect. It's just an opening that is here. You see, it's not supposed to be. This one is a defect again. You have ventricular septal defect. It's a defect. So it's not like this one that was supposed to be, and when it comes out, it becomes. There's another one that's outside the heart. Some people think it's a hole in the heart. It's not hole in the heart, but it comes in the artery, because this one, this pulmonary artery opens up from here, and the aorta opens up from here. And when they reach this part in the womb, this particular one joins the aorta here to allow the blood that is coming here to go back again here, so that the cycle continues. So that whichever one comes here, the cycle continues to the placenta and the rest of them. So what happens now is that this particular one that joins here is supposed to close up like this one when it comes out, and it's called ductus arteriosus. So when it doesn't close up, there is a name now given to it, patent ductus arteriosus. Just like this one, when it doesn't close up after the womb session, it becomes a patent foramen over. So I tried to make this video, don't worry about my speed, but I hope you're understanding the content. Sometimes people don't really follow up when the video is too long, but for this one, I might do it and watch how you follow it so that I will be able to equally be more calmer and give you what you will be able to understand better. But hopefully you will understand this. Haven't done it in live where I equally had time on the live. But I believe that with this one, which comes as an appendage to it, you will be able to understand this very well. So those symptoms are all the same. Now you talk about what are the treatments. Treating this comes with a lot of kind of procedures. One of them is you have to diagnose. Diagnosing comes with a echocardiography to be able to detect whether this child is actually suffering from something else or this. Test for the heart actually has to be done as well to rule out certain other suspicions or diseases. Then with the cardiography, you'll be able to get it. And there are different kinds of cardiographies. Echocardiogram, you do that. There's one you use contrast, which helps to detect exactly what actually is this child suffering from. And it helps the doctors to begin to treat with something like catheterization. Yeah, there is a catheterization which you use to ensure that this place is closed up, so not allow blood clotting that usually leads to stroke in this child. There is equally one called amblaza PFO, amblaza patent foramen over, or amblaza ASD. So these could be used in treating both these or this. But earlier on, the doctors start with indomethacin. How it's treated is not what you have to bother about, because you must see a specialist to be able to get this treated, and as well as going to do other procedures that will help in terms of treatment. With this could cause a lot of complications. I've just mentioned heart failure as one of the things it's caused, and there are a lot of other diseases, and ultimately death of this child. So we wouldn't want it. All we want is that every child that is born survives, and this heart has to be preserved. But it is for you and I to enjoy our heart and live better. This is Ozio the Expressionist, your host and anchor of this program, and I believe this video makes sense to you. And if it does, please like, share, circulate, that others will understand and equally learn. And I remain your host and anchor on this program. Remember, this is the program you love, your favorite health center on the internet, the Health Center with Ozio at Kunye. See you next time. And please drop your questions here and ask anything concerning this, and I will try my best to respond to you. Thank you very much, and continue to follow Kunye. Bye-bye.